Hello, everyone. This is the Average Pharmacist here. I do apologize. It's taken me a very long time to upload a new video. I've just been very busy with a lot of things. However, I'm going to be a little bit more consistent in uploading my videos. So if you would hit that like button, if you would subscribe, and if you take the notification bell, then you will get a notification whenever I have a new video. So let's get right into it. Someone had left me a comment to speak about Ativan, and that's what our video is going to be about today. So the brand name of the drug is called Ativan. The generic name of the drug is called lorazepam. It's typically prescribed and dispensed as lorazepam, so I'm just going to refer to it as lorazepam from now on. So lorazepam is in a class of drugs called benzodiazepines. Other benzodiazepines you may have heard of are Valium and Xanax. So drugs in this class can treat illnesses such as anxiety, insomnia, and seizures. So lorazepam is indicated for the management of anxiety disorders, or for the short-term relief of symptoms of anxiety, or for anxiety associated with depressive symptoms. An important point I wanted to stress is that anxiety associated with stress of everyday life typically doesn't warrant treatment with anxiety medications. So there really have not been trials to assess the effectiveness of lorazepam in long-term use, and long-term use is 4 months. So as a result, the doctor should periodically assess the usefulness of the drug for the patient using it. So lorazepam and other benzodiazepines, they work by increasing the effectiveness of the endogenous chemical, GABA, to decrease the excitability of neurons. So GABA is the most common neurotransmitter in the central nervous system, and it is found in high concentrations in the brain. So GABA is inhibitory, and it reduces the excitability of neurons, and it produces a common effect on the brain. So as you can see in this diagram, and here I just want you to focus on the benzodiazepine section, because that's the class of drugs that lorazepam is in. Benzodiazepines, such as lorazepam, enhance the effects of GABA at the GABA-A receptor via increasing the frequency of opening of the chloride ion channel on the GABA-A receptors. So this results in the therapeutic actions of benzodiazepines. So an important point is that using lorazepam with opioids, and what opioids are, they're pain medications, these strong pain medications. So hydrocodone, oxycodone, this is what we call opioids. So using lorazepam with opioids can cause profound sedation, respiratory depression, coma, and it actually can cause death. So a combination of these drugs should only be used in patients who have inadequate alternative treatment options. Also, using lorazepam can lead to physical and physiological dependence. So the risk of dependence, it depends, and it comes with higher doses, and it comes with longer term use of lorazepam. So there is a black box warning in lorazepam's prescribing information about this dependence, misuse, and abuse of lorazepam. And if you don't know what a black box warning is, it's called a black box warning, or it's a box warning, and it's required by the U.S. Food and Drug Administration for certain medications that carry serious safety risks. Often these warnings communicate potential rare but dangerous side effects, or they may be used to communicate important instructions for safe use of the drug. So the dependence is further increased in patients who have a history of alcoholism, drug abuse, and in patients with significant personality disorders. So the dependence is reduced when the lorazepam is used at the appropriate dose for short-term treatment. So by short-term treatment, I mean like 2 to 4 weeks. So these types of medications, they only should be used for short-term periods. And as I mentioned before, that will be about 2 to 4 weeks. So if an extension of therapy is needed, the patient needs to be reevaluated to see if there is a need to continue therapy. Continuous long-term use of lorazepam is not recommended. You also can have withdrawal symptoms upon discontinuing lorazepam. And as I mentioned before, lorazepam does have physical and physiological dependence. So you will have these physical and physiological withdrawal symptoms as shown in this diagram here. The next picture is just an overview of some of these withdrawal symptoms also. But there's a long list of withdrawal symptoms that you can actually experience if you abruptly stopped lorazepam. And these can include headache, anxiety, tension, depression, insomnia, restlessness, confusion, irritability, sweating, dizziness, numbness, tingling of extremities, hypersensitivity to light, light and noise, nausea, vomiting, diarrhea, palpitations, and panic attacks. And that's just to name a few. And that, just like I said, that was a long laundry list. It's like those lists of side effects when you hear the commercial, but they say them so fast you don't know what they are. So, I just decided to just, slowly and methodically tell you what some of those withdrawal symptoms are, and it could be other ones also. So, those withdrawal symptoms actually can appear, as soon as a week. And like I said before, they come if you just stop taking lorazepam. So if you're going to stop lorazepam, your doctor just has to gradually taper you down to get off the medication safely. So lorazepam, as well as other diazepines, they can cause a lot of central nervous system effects and respiratory depression. And these effects are dose dependent. So what that means is the higher the dose, the more severe the effect. So because of this, there should be caution used in patients that have a compromised respiratory function, such as COPD and sleep apnea. Elderly people on lorazepam also have to be careful because they're more susceptible to the sedative effects of lorazepam. Overdoses have occurred with lorazepam and benzodiazepines, and it typically occurs if you mix it with alcohol and if you mix it with, like I said, those opioids, so that hydrocodone and oxycodone. So mixing lorazepam with these drugs and alcohol can result in central nervous system depression, and that can range from drowsiness to coma, and unfortunately it can lead to death. So it's very important to not take lorazepam with alcohol, and you should not be taking it with opioids. The only reason you should take it with opioids is under the supervision of a doctor, under the care of a doctor that knows you're on both medications, and they can closely monitor you. But you absolutely cannot use lorazepam and alcohol together. It could kill you, unfortunately. So this was just a very brief overview of lorazepam. Like I said, I just like to give you a lot of information for a short period of time, just an overview, because a lot of people are prescribed these medications and they don't know what they're for, they don't know their side effects, and I just think it's very important, if you're going to put something in your body, you should know what it's used for, you should know what the positives are, and you should know what the negatives are. So this is a medication that is obviously prescribed a lot. I've seen it a lot in the pharmacies, and if there's anything you feel uncomfortable with, if your doctor will prescribe you this medication, I definitely would give those concerns to the doctor, talk to your pharmacist, and see if there's other methods to help your anxiety, whether that's non-pharmacological, like talking to a therapist or talking to a family member, or, as things like that. And if your doctor wants to go this route, I definitely would talk to him about any issues you may have, and never be afraid to talk to your doctor if something's concerning you, or you can go to your local pharmacy. So, hope you guys enjoyed the video. If you hit like and subscribe, that'd be great. Hit the notification bell. And if you want a video about something in particular, if you leave a comment below, I will make that my next video. If not, I'll just come up with an idea and have a video for you guys shortly. And thanks a lot. Thanks for watching, and you enjoy the rest of your day.